अस्सलामुअलैकुम दोस्तों, जैसे कि आपको पता है कि हमने एडल्ट हेल्थ नर्सिंग के लेक्चर की स्टार्टिंग की थी, जिसका पार्ट 1 हमने अपलोड कर चुके हैं, जो कि ऑर्थोपेडिक चैप्टर था। उसका ऑर्थोपेडिक चैप्टर का पार्ट 2 है ये। एक्सरेज सीन प्लेन एक्सरेज आर मोस्ट वैल्यूबल फॉर डिटेक्टिंग abnormalities in the bone and are taken to eliminate painful deformed to suspected abnormal areas of bone. Often X-rays can help to diagnose fractures, tumors, injuries, infections, and deformities such as conjunctiva, hip dysplasia. X-rays do not show soft tissues such as muscles, brushes, ligaments, tendons और nerves. ये एक्सरे किया हुआ है, जिसमें क्या हुआ है, हमारा जॉइंट जो है मिस हो गया है, मतलब हट गया है अपनी जगह से। ड्यूअल एनर्जी एक्सरेज absorptiometry DX the most accurate way of evaluating bone density, which is necessary when screening for diagnosing osteopenia or osteoporosis with dual energy X-rays absorptiometry DX है। ये है मशीन इसकी, जो कि डिजिटल मशीन है। सीटी स्कैन, जिसको कहते हैं कंप्यूटर टोमोग्राफी, सीटी स्कैन एंड मैग्नेटिक रिजोनेंस इमेजिंग एमआरआई। कंप्यूटर टोमोग्राफी एंड मैग्नेटिक रिजोनेंस इमेजिंग give much more detail than conventionally X-rays and may be done to determine the extent and exact location of damage. These tests can also be used to detect fractures that are not visible on X-ray, such as some small fractures of the hip and pelvis. MRI is especially valuable for imaging muscles, ligaments and tendons. ये मशीन है सीटी स्कैन की। Compute tomography and magnetic resonance imaging MRI. MRI can be used if the cause of pain is thought to be a severe soft tissue problem. For example, rupture of a major ligament or tendon or damage to important structures inside the knee joint. CT scan is useful for MRI is not recommended or unavailable. Lumbar decides ये lumbar region की है। Spinal canal infections, vertebra, arthritis, enhance। ये लंबर रीजन में मसला है, इन्फेक्शन है, उसकी तस्वीर है सीटी स्कैन या एमआरआई की। Ultrasonography is being used more and more frequently to identify inflammation and around joints and tears or inflammation of tendons. Ultrasonography is also used as a guide when a needle needs to be put into a joint, for example, to inject drugs or to remove joint fluid. As an alternative to CT scan and MRI, ultrasonography is less expensive and unlike CT involves no exposure to radiation. अल्ट्रासाउंड की बात कर रहा है कि अल्ट्रासाउंड इतना ख़तरनाक नहीं होता, ये सिंपल होता है और सस्ता भी होता है, आप हर जगह करवा सकते हो। Joint aspiration arthrocentesis is used to diagnose certain joint problems. For example, it is the most direct and accurate way to determine whether joint pain or swelling is caused by the infection or crystal-related arthritis such as gout. Joint aspirations. For this procedure, a nurse first injects an anesthetic to number the area. Then the nurse inserts a large needle into the joint space, draws out, aspirates joint fluid, synovial fluid, and examines the fluid under a microscope. Joint aspiration, a nurse removes as much fluid such as possible and notes its color and clarity. Other tests such as white blood cells count and culture are done on the fluid. The doctor can often make a diagnosis after analyzing the fluid. For example, a sample of fluid may contain bacteria which confirm a diagnosis of infection. Arthroscopy is a procedure in which a small diameter of pencil fiber peptic scope is inserted into the joint space, allowing the doctor to look inside the joint and to project the image onto a video monitor. Tractions and amputations. In orthopedic medicine, tractions refer to the set or mechanism of strengthening breaking bones or relieving pressure on the spinal and skeletal system. There are two types of tractions, skin tractions and skeleton tractions. तो ये MCQs आ सकता है इसको ये लास्ट डायग्राम थी एप्लीकेशन ऑफ स्किन ट्रैक्शंस एप्लीकेशन ऑफ स्किन आगे पढ़ेंगे तब तक के लिए रखते हैं इस लेक्चर को इस तरह यहाँ तक और अगले पार्ट में देखेंगे इसका नेक्स्ट पार्ट